Hi, I'm Dr. Bonnie Clipper, the Chief Clinical Officer at Wambi. Today, I'm here with Dr. Maria O'Rourke, President and CEO at Maria O'Rourke and Associates. We want to share a few moments of insight, gratitude, and inspiration with you. Maria, thank you for taking time to be with me today.
Thank you, Bonnie. This is such a privilege and honor to be part of this with you. And I want to first and foremost share my gratitude. It abounds every day. 50 years a nurse, and I never cease to be amazed at how amazing nurses are and the healthcare team. Their resilience and empathy and humanity is just inspiring every single day. I'm grateful to every single healthcare worker, every first responder who has just simply put their lives on the line so selflessly for all of us. And I will be eternally grateful, as will my children and my grandchildren, for how they have helped us handle this horrible epidemic. But I've seen this before. I'm inspired by this monumental response today, and yet I saw the same thing happen in San Francisco General Hospital in the 80s, 1984 and 89, when we dealt with the AIDS epidemic. I saw this amazing response from healthcare workers, physicians and nurses and dietitians, and we didn't know what to do with AIDS patients. All we knew is that they were dying and we needed to take care of them. And there was this amazing response. And so I feel the same sense of gratitude and toward the team that has come together and put themselves on the line. Empathy just exudes all over the place. The risk-taking is just extraordinary. And at my age, at 77, I have to be a bit careful, but even then, in times like this, you need to go where you need to go. I also experienced, as a 9-year-old, the polio epidemic. I know what it was like to have to shelter in place. We didn't call it that, we just were told, stay home. And we did. And everything was shut down, and you couldn't go to the movies, and you couldn't go out, and you couldn't play. And you know, the good news is that I had a brother, and sometimes we fought and sometimes we didn't fight, but for the most part, we stayed home. But I'm witnessing today some of the best and the worst in people. Just like I did in San Francisco at the General, when we had people who didn't particularly think we should be taking care of people with AIDS, because it was those people, those other people that had this disease. And when I liken what is happening now with our healthcare team and healthcare workers going into these hospitals and staying there and being by their side and crying with their patients, this is what happened. And this is what nurses do, and this is what healthcare workers do. So I think one of the biggest insights is the fact that we have no public health system. In the 50s, we did. I mean, I remember going through the Boston subways with my mom and seeing signs that says, don't spit. Why? Because we had a public health system that says, that's where you got tuberculosis, so don't do those kinds of things. In the AIDS epidemic, at least in San Francisco, we had this amazing healthcare system. The public health system in San Francisco was the epitome of how a public health system should work. And today, I don't think we have that. We don't have public health nurses. We don't educate nurses to the prevention and the public health side. Our focus is on acute care and maybe a little bit of aftercare, but we're not a public health system. And I think this epidemic is really raising our awareness at how desperately wrong our healthcare system is, and how it's focused on just some of the high-profile diseases and not on what really happens to people in their health. It has to do with disparity. This particular epidemic is showing how vulnerable populations are, and even with nursing's very serious efforts over the last 10 years of bringing the issues of healthcare issues within diverse populations and underserved populations, we haven't even touched the tip of the iceberg. So my inspiration comes from watching these first responders, nurses and doctors in particular, who cry with their patients while they're using their skills and expertise to keep them alive or help them achieve a peaceful death. And to know that we have a lot of work to do in nursing, to change our education system, to make sure that we're educating nurses to be public health nurses, to get out there and educate the public. I am amazed at how, actually I'm not amazed, I've been concerned at how little the public knows about epidemiology and how disease spreads and how we can still talk about this epidemic as a hoax. That is an uneducated public. It's a public that doesn't understand science. And we have to do better at raising a whole new generation of Americans who truly understand what science really means, how it can help us, how we can stop and prevent epidemics, and what they have to do as responsible citizens. So I've learned from this experience. I hope if we don't learn from this experience, I'm very concerned this will happen again and again. And our healthcare resources right now can't handle any more of this kind of intensive overwhelming of our healthcare system. We're not prepared for it. So lessons learned, we need to educate the American people to public health. We need to educate more healthcare workers to go into public health. And we must learn every single lesson we can from this epidemic and turn it into an opportunity. So thank you, Bonnie, for allowing me to share my thoughts. I'm very concerned about what tomorrow will bring. We still will may be facing a second and a third wave, and we need to be resilient. And one thing I know about nurses is that they're resilient.
Well, Maria, thank you for your service as a nurse for 50 years. That's powerful. And I think you're right. The message here is we are resilient, and it's important for us to learn what we can and take those lessons and apply them going forward. So thank you for taking the time today. Really appreciate that. And I'm Dr. Bonnie Clipper. And remember, at Wambi, moments move us.